In today's VETgirl podcast, we dive into the critical need for strong leadership in vet med and explore how we can build a better future for the profession. From mentorship programs to formal leadership training, we discuss actionable steps to create growth opportunities for veterinarians. Learn how we can all empower the next generation of veterinary leaders to navigate challenges and drive innovation. Hear also how one vet, Dr. Marissa Brunetti, has invested her own career into creating better ways for vets to grow and thrive. Hi, Dr. Amy Kaplan here. I'm excited to be talking today about leadership, such an important topic. I'm joined today by Dr. Marissa Brunetti, Chief Veterinary Officer, to discuss the importance of leadership in vet med. Dr. Brunetti, before we jump into our questions, could you tell us a little bit about yourself?
Yes, thank you for having me. Number one, this is a great topic as well. I love speaking about it. But my name is Dr. Marissa Brunetti. I am the Chief Veterinary Officer at Indie Vets. And I actually have been a veterinarian since 2010. I graduated from Penn and I live outside Philadelphia. I've been a general practice small animal veterinarian since then. And I've also dabbled in shelter medicine. I'm really, really interested in spectrum of care. And I'm also very interested in veterinary leadership and mentorship. And so basically training the next generation of our vet leaders. And I've been with IndieVet since we started in 2018. And so it's been amazing. We started with about 5 doctors outside the Philadelphia area. And now we have over 270 doctors in 33
Wow,
states. Yeah. So it's
excellent.
been great.
Wonderful. All right, well, let's dive in. So, I feel like, at least for me and my vet class, we didn't get much leadership education in vet school training. I think most of us would say that we understand, at least on the surface, that good leadership is important in our practices, right? But would you help us to have a deeper understanding of why? For example, like why is strong leadership so crucial in veterinary medicine, and how can it directly impact animal care and the overall success of a practice?
So true. It's a great question because we do, right? We spent 4 years cramming diagnoses into our head and treatment for animals, and not a lot of time was spent on emotional intelligence and leadership. Now, I know recently they have been starting to build on that and at least giving some time to these very important topics, but that's only been recently. And so it continues and should continue after graduation for a number of reasons. So when I'm talking about leadership and how it can improve the hospital culture, right? I think it improves the culture and the efficiency of people. It improves the team's overall balance and accountability, which leads to increased retention of team members and less burnout from team members because everyone's kind of rowing together. I think it increases the standard of care, right, for all of our patients, which leads to less fear, anxiety, and stress, not only in patients, but in clients and in the team members. And, it increases education. I always say that we are continual learners, and increasing leadership education and personal development can really bring that team culture together and form more belonging, right? And that is then shown to clients and patient care as well.
Excellent. Yeah, I couldn't agree more with that. What about the challenges to leadership opportunities? There's a well-documented leadership gap in vet medicine, particularly for women. So, what are some of the barriers that prevent veterinarians, and especially women, from accessing these leadership roles? And how can we overcome them?
I agree, right? More recently, opportunities have been given to veterinarians to be leaders, but there is a strong notion in the industry that all veterinarians are naturally leaders. And so they drop us into a practice, and people naturally look to us as the leaders without much training and without much future development. A lot of mentorship is focused on the actual clinical skills, right, that you need to be a doctor or communicate with clients. And not a lot of mentorship is provided on how to be a leader, both of yourself and of a team, and then of an organization. I am happy to say that I have seen a lot more veterinarians sitting at the table now in corporations, both regionally and nationally. And I think that that greatly improves the standard of care across the board. Now, one other thing I think that has gotten in the way of more veterinarians improving in their leadership and then being given opportunities is that this outdated notion that veterinarians are only valuable if they're producing revenue directly for a practice every day, right? We, yes, produce the revenue for a hospital, and you need a veterinarian to have a veterinary hospital that is successful. However, not a lot of time has been given, right, for veterinarians to step out of clinical practice and do the development they need, right, to become great leaders. The return on investment for just taking a doctor out for one day, right, to actually develop them, the return on the investment is huge in the term of increased retention for staff, increased efficiency for the whole staff, decreased burnout, right? And having that team being able to row together is so valuable. So first we have to like throw out that notion that veterinarians are only valuable if they're producing and
Right.
understand that all vets, right, need additional leadership development. And even despite these challenges, a lot more has been put into leadership training on the VETgirl side, right? AVMA with Mentor Vet. I'm going to call them out because we work with them a lot. And it's about training mentors too, right? Mentors are leaders. And we assume again that all vets are great mentors. Not the case, right? Not all vets are great mentors. Not all vets are great leaders. And so being able to seek out those opportunities on your own is really important. They're there and they're becoming more and more available. So I just want to tell people like you are in control, right, of your development to start, right? And there's stuff out there. There's great things out there.
Yeah, we were talking about this a little bit before the podcast that you don't just wake up with these great leadership skills, right? Like that you've got to go through training to learn them. So, what do you see as some of the main skills that veterinarians need to learn for leadership roles?
So something we often forget is you have to focus on yourself first to be a good leader. It sounds selfish, right? Because we are veterinarians and we've been giving our lives to animals and people for decades. But leadership core competencies start with leadership of yourself. At Indie Vets, we've launched something called Indie Academy, and we have a leadership level one course that our clinical leadership team has actually helped put together. And so I think it's really important that there are three major areas of leadership to develop core competencies. And first and foremost is like leadership of self. And those big competencies that we hear all the time, right? But it's hard to put into practice are emotional intelligence, right? We'll talk a little bit about that later. Communication skills, integrity, time management, and critical thinking and decision making for yourself, right? And working on yourself first, understanding your triggers, understanding where your strengths and opportunities are. You have to get there first before you can get to the next step, which is, leading people and leading teams. Some competencies for those leadership skills are, elevating performance in your staff, coaching and motivating them, whether they're doctors, CSRs, or technicians, delivering feedback effectively, which we all know people never get taught how to give and receive feedback appropriately,
Yeah.
and delegating. That's a huge one. That took me years to learn. I think my team can tell you that, but delegating
Give
and
up the reins
impact.
and delegate.
Yes, exactly. Right. Like I don't have to draw the blood on everything. Okay. Like
Right.
I can teach you how to do it and then you can go do it. And then huge one in vet med, right? Conflict management and
Mm.
resolution. And when I think about this, I not only think about the teams, right? Toxicity amongst teams, the front versus the back, but also clients, right? Like clients and the stress of dealing with clients who are unhappy or sad or agitated. And so I think leading people and teams only comes after you know how to lead yourself. And then there's the much broader competencies of like leading organizations or leading within organizations, which is, values driven leadership, building a culture, right, that give to everyone. And then big thing in vet med, leading and managing change. It's huge, right? Even if it's just one hospital that you're leading and managing change in, like how are you going to get your whole hospital fear-free certified, or at least, doing fear-free throughout the hospital? That requires months and months of managing a change process to get everyone on board. So I think that we don't talk about that enough, and these three big core competencies that you need.
Great. Yeah. So, it really resonates with me in particular, having experienced a formal mentorship program in ECC on, my path to getting board certification, that you emphasize the importance of mentorship in cultivating leadership. And it just makes so much sense to undergo training with that direct mentorship for this role. So, can you share with us how a structured mentorship program, like the ones you offer, can help to build and support our next emerging veterinary leaders?
Yes. So mentorship is very near and dear to our heart. We did start the first ever, I would say, mentorship program in a relief setting. And the reason we love mentorship is because it goes both ways all the time, right? It's not just this mentor teaching this mentee, and it's not just clinical. I think we forget about that a lot, right? Being a great veterinarian is, yes, your clinical skills, but it's also so much more about your interpersonal skills and also your leadership skills. So, first, we like to talk to people that mentorship goes both ways. I was mentoring one of our young doctors last week, actually, and this week, and I've learned so much from her because she's just out of school and she has learned things differently than I have. And I think that that's so important to understand that it goes both ways. It's also not just for early career veterinarians. And I think mentorship for leadership in particular is so important, right? Let's change the language around mentorship. You could only want to be mentored in one thing, right? Like, I need more help on learning how to delegate more appropriately, right? And being able to put two people together to make a plan for mentorship. It doesn't have to be a huge program, though it can be, and we have those, but it also can be a very, very specific thing that you're mentoring on. And you can come together with someone who has had that experience. You put a plan together and then you go from there. So I like to get across that mentorship goes many different ways and it always goes back and forth, especially between two veterinarians. Also, in leadership, your mentor doesn't have to be a veterinarian. It could be an operational leader on your team if you are, in a corporation, or it could be someone from marketing, right? If you are more interested in learning how to write, as a veterinarian or how to speak publicly. These things, you should not hold yourself just to another veterinarian in mentorship. And mentorship also has levels, right? We start very hands on with our younger doctor mentees where they're just shadowing us for a little while and understanding, right? Again, that a doctor doesn't have to be producing revenue directly to be successful and be learning. And so we allow our mentees to shadow us in all different types of clinics and situations. And then we work side by side with them. So we are always there. And then we move to a more indirect aspect of mentorship, which is how we run our leadership programs too. I also think, lastly, mentorship is so important for that medical director type role, right? Not
Mm,
everyone has that title, right? But that doesn't mean that they're not acting like a medical director. But
right.
how often do you hear that medical directors get training, right? So we are currently about to launch a medical director training program for our doctors because it's not just about having great clinical skills, it's about financial literacy so you can have better business outcomes. And it's about bringing your team together and improving that culture. So I think there are many different ways that you can have a mentorship program, and it's not just in the way that we think about it right now.
I love that because I'm just thinking like for any kind of training, it's one thing to just sit there with a book or an online course and think that, that's going to make you a great leader just by learning the actual material. But having that mentor there, it's that real one-on-one interaction to help you really hone those skills. So that just makes a lot of sense to me.
Yeah,
Now, how
thank you.
about the actual leadership training? How can formal leadership training, like the certification courses in vet leadership and practice management, how can those support the growth of veterinarians into these leadership roles? And do you believe that the training is currently being prioritized enough?
It is becoming more and more prioritized, I would say. But a lot of times when you start, you're going to have to advocate for yourself. And I think that's another big thing that I say. First is to acknowledge that you are a veterinarian. You, as a veterinarian, are a leader every day, no matter where you work. And number two is to understand that you're going to have to advocate for yourself in the beginning. Someone is not going to always come up to you and say, you would make a great leader. Let me lead you through this process, right? That is amazing. And sometimes that happens. But as vets who are working constantly in the clinic, usually, you're going to have to start advocating for yourself baseline. And so I love this example. There's a veterinary leadership conference every year. It is in the dead of winter in Chicago, so not the best
Ooh, cold.
best area. Yes, but I went in January for the first time, and I actually saw some of my indie vets there who are practicing general practitioner doctors, but they were ultimately interested in leadership. And they took the initiative to go to this conference on their own, right, to start their baseline knowledge. And I think as doctors, we have to seek that out. Yes, there is, all the clinical stuff to continue on your continuing education journey, but a lot of leadership stuff is race approved now. And I think that that is so important to not only read books, right? Like I think of these two books that I've read all the time, right? There's a book called Leadership Mind Traps. It's so short, but it is so practical. And it's one of the first things that like I had my team read together. There's also books like The Five Dysfunctions of a Team. Man, when you read that book, you're like, oh, totally. I can see this in my small clinic that has one doctor versus a giant clinic versus an organization. And so there are lots of things that you can start to do, right, to develop your leadership skills and make it known. Put it out there, right? Tell people that you're interested in leadership. Your ultimate goal is to learn more about this because they may not be thinking that you need mentorship directly, and you do. And so I think being able to advocate for yourself as veterinarians is very important in this.
Excellent. Now, just thinking about inside the practice for a minute. So, I know you talked about some of the leadership positions that we have in a practice, something like a medical director, for example. So, in your experience, what impact did these in practice leadership roles have on a veterinary practice's culture and its ability to provide high quality care? And how can practices create these opportunities for growth?
Great question. Because, as I mentioned above, a medical director not only provides staff with education and training on high standards and evidence-based medicine, but also leads by example. So you may not have a title of a medical director, say, because there may be another medical director, or there may not be that role even available, right? But you can act as a leader even without a title, right? So I usually say not all leadership comes with a title. It comes by leading by example. It comes by communicating with staff. It can come in really small ways. So like when I was a young doctor and I knew I wanted to be a leader or have more of leadership skills, I started by asking if I could run the doctor's meeting every month, right? And I would bring new standards, I would bring new drugs to the meeting, we would discuss it, right? And then that kind of developed into providing feedback to each other as doctors. And so it may be something as simple as you noticing something that your clinic or your team doesn't do, a book club on leadership, right? We do that often. My favorite one also to plug here, and I love plugging books, but Brene Brown and her Dare to Lead book is one that we have reviewed on our team many times. And I think it would be just so great if clinics had leadership book clubs that they could talk with each other about. So even if there isn't a medical director title, I want people to understand that you can do things in leadership to help your team. But even with medical directors, we talked about how they are at building culture, right? And bringing standards, higher standards, or things like fear free, right? They bring the whole clinic together and it helps de stress people when you de stress animals, right? Distressed animals cause distressed people. We've all been there. I mean, you as ECC
Oh, yeah.
totally understand that. And so when we can be leaders of ourselves and understand that, we can actually help our staff understand their triggers and lead them through that process. It ultimately helps the culture of the clinic so much. It increases the efficiency, which increases business outcomes in a good way. So overall, I think all of these things are excellent, but we need to support each other in developing these skills.
Awesome. And now veterinarians we're often working under intense pressure, right? So
Yeah, you
how,
especially.
oh yeah, the ER world, gotta love it. So how important is emotional intelligence and resilience in leadership? And how can these skills be developed within the veterinary field?
Great question. And it comes to that first level, right? Leadership of self. Emotional intelligence is the first thing I think of. And when we train our HQ staff or our doctors, that encompasses four things, right? Self awareness, self management, social awareness, and relationship management. And when you break these down, you realize that as a veterinarian or as a technician or nurse, as a CSR in the clinic, all of these things are very important. And so self-awareness is really becoming aware of your triggers. I know that I'm a very impatient person. And so someone that is talking on and on, like in a clinical setting, right? Like a client whose history is like 10
Oh,
minutes, right?
yeah.
I understand that that is a trigger for me and like will shut down like my listening skills. And so I have worked on this, right? Understanding like the physical signs that come with that trigger, journaling about it, and I thought something great that our training and development manager taught me is that if you're venting about something, you are triggered, right? You are triggered about it. And I know we vent a lot in practice. And so first understanding, what behaviors trigger you and how you can manage your response to them is really important. That's where that self-management comes in. And I am really bad at pausing. And so, what I've done in the clinic and in my HQ world is I put the word pause, but PAWS, not pause, like
Clever.
PAUSE.
Clever.
And I've drawn a little paw print, right? And that has helped me understand, Marissa, you need to pause. Okay. Think about the pause, the toe beans, right? And understand that, sometimes you need to take a breath, right? Our days are crazy. Sometimes I need to just step outside the back door. Sometimes I need to go to the bathroom and do some breath work, right? We talk about breath work a lot. What the heck does that actually mean? Everyone talks about square breathing, right? Or the 4-second breath in and out. But I encourage people to look more into breath work and things that you can do that literally are 15 seconds. My patience level for like meditating for 5 minutes is ridiculously short. So I'm like, can someone teach me how to meditate in 30 seconds? And the answer is yes. Absolutely yes. You can do it between exams. So that is that self-management that comes with learning your self-awareness. And then social awareness, which is understanding how like your body language and your tone of voice, right? It influences other people. And we know that our body language is over 50% of how we come across. And just our words alone are like 10%. And so understanding how that whole process comes across to a client or to a staff member can really improve relationships, which gets you ultimately to be able to manage that relationship. And that is so, so huge, right? We have a million relationships in the clinic or in an organization. And so you really have to do steps 1 through 3 before you can really be an incredible relationship manager.
Great. Thank you for that. All right. And my last question for today is about the future of veterinary leadership. So, as we look toward shaping the future of veterinary leadership, what are 3 actionable steps that veterinarians, practices, and industry leaders can take away from today to start fostering a more inclusive and effective leadership pipeline?
Great question. And I'm going to give you like 5 or 6 things.
Three is just more of a guideline, really.
Yeah, three is like the baseline, right? So first step is to acknowledge and speak your goals into the world. I am like a huge person about manifesting, and I really think if you want more training, not necessarily to be a titled leader, but you want to be a better leader in your practice, you have to acknowledge first that you want to do that. And you have to acknowledge that as a veterinarian, you are a leader every day. Put those goals out there in the world. Number 2 is take that first step of developing yourself. It may be a leadership program specifically on emotional intelligence. It may be a book. It may be a course online, right? There's lots of vet courses now in leadership. It may be that conference that I talked to you about, like the Veterinary Leadership Conference. Third, develop a mindfulness practice, develop a breathwork practice for your self management, because we all know, like I said, leadership of self has to come first. And then talk to current leaders of your team or your organization, make your intentions known, right? This pipeline of leadership, as from young leaders to more developed leaders, this is going to have to continue year after year after year as we develop a practice. So let it be known. I want a mentor, whether that's a medical director or I want a mentor that's really great at conflict resolution. That could be a practice manager or an operations director. And then offer to start your leadership journey small. right? Tiny steps. Lead a meeting. Talk to your techs every month about a new medication that's out. Talk to your whole practice about fear free and how that starts with the person who answers the phone and talks to the client, right? These are all small things that can lead to bigger roles as leaders, whether they're titled or not. And it helps the whole team understand, and they will look to you as a leader. And that is the beginning of the process for these actual leadership trainings, which is my sixth. So I doubled it. My sixth is, seek out that leadership training. It is there, right? And if you need help supporting like financially for this training, talk to your clinics, right? They may not even know that you want to do a course in leadership or in emotional intelligence or meditation, but talk to them. I think this is incredibly valuable because you can't assume that people know that you want to be a leader, right? Even if you're the veterinarian, right? Like I said, they just assume that you're a great leader as a vet. But we all need to develop in different ways. And this will help not only your professional life, but also your personal life.
Great. Well, this is such great information, Dr. Brunetti. Thank you so
Great.
much. Developing good, effective leadership is just so vital to creating a healthy work environment and, a functioning practice. So this has been great information. I so appreciate you being here today on
Thank
this VetGirl
you.
podcast. Thank you.
Thank you so much for having me.